Good afternoon. For those of you joining, we will get started in just a few minutes.
It's still morning for some of us.
Did I say good morning? I'm still drinking caffeine. I think it's just the story of my life. I am mountain time. I don't think it's really still morning here, but no, maybe for you, West Coast.
Definitely still in Alaska.
Sun's definitely up in Alaska.
Then that's fair.
One of my friends was up in Alaska. They sent a picture in the last couple of days from 11:30, and it looked like it was about as bright as it was here in Boston at 5:30 in the afternoon. For comparison.
Oh yeah, it's that time
Not
of year.
unexpected.
We go to sleep and it's light, and we wake up and it's light.
Not
You have
unexpected.
blackout curtains. It's pretty cool though. You can go hike it.
It was
9
wild
p.m.
to like hit the point where I was like, I now have as much daylight after work as I used to have an entire day. But that, yeah, just the daylight math gets wild.
Yeah, it's got to be something to get used to. Thanks again to everyone for joining. We'll get started in just another minute or two. Give people some time to log on. Lux, can you see how many we have on at this point?
We have about 27 as of now, 28.
Okay. Everyone, I'm going to give it just another minute. Lux, I think you can go ahead and fully open that waiting room. And I will get started. So welcome everybody. This is our second TEFCA Public Health Community of Practice meeting. So being led by the Office of the National Coordinator for Health IT and the CDC. So again, for those of you who weren't here last time, my name is Liz Abbott. And I am a contractor with HLN Consulting, supporting the facilitation of the COP along with other HLN, ONC, and CDC colleagues who are on this call. So today we plan to spend most of your time hearing from some of your peers as part of a panel focused on getting started with TEFCA. There will be plenty of time for questions and discussion following their shared experiences. And first, we'll cover a brief recap from our April COP kickoff meeting, and then we'll finish the meeting hearing about a couple of partner resources that you may be interested in that are relevant to the conversation from today. So just a few objectives to keep us on track following today's meeting. You should be familiar with some examples of other jurisdiction efforts and progress with getting started with TEFCA, as well as some association resources that are relevant to determining how and where to get started. So I'll share more about that when we get to those parts of the meeting. And just a few housekeeping reminders. Please rename yourself to include your agency or your state or your association acronym. Feel free to type in the chat to introduce yourself. And please stay on mute when you're not speaking, but you can use the chat or select the reactions icon to raise your hand when you do want to raise a question and participate in the discussion. And if you have any technical issues, please reach out to Lux in the direct messaging in the chat. And as you should have been notified when you joined, this meeting is being recorded, so we will plan to share the recording out as soon as it's available after the meeting. And so we just wanted to take a minute to give a very high level recap of the April meeting. And so, we talked a bit about the structure and purpose of the COP and, provided some background of the value of that. And so, the purpose of this COP is really to provide a forum for state, tribal, local, and territorial public health agencies and partner subject matter experts to share knowledge, barriers, promising practices, and opportunities. And this will help inform strategies and resources to advance participation in TEFCA among public health. And so, really, we're here to provide a forum for you all to have peer-to-peer exploration, learning, and collaborative problem solving around topics such as the value of participation, potential use cases, and informing any sorts of resources that might result. And, I think Abby shared a lot last time about this is really phase one before some of this work transitions over to the implementation center work that is coming. And so we circulated the charter and incorporated feedback. So thank you for feedback from anyone who did share that with us. And we will keep everyone apprised as plans transition down the road. And then, just per information that you all shared as part of registration and pooling at our last meeting, these are some of the high level key topics that you're interested in learning more about and discussing as part of the COP. So there's more specifics behind some of these, but, today we're really focusing on that. How do I get started to participate in TEFCA? And future meetings will cover some of these other topics. So we are going to jump in to our panel. We really wanted to save the bulk of this time for you all to hear from your peers and have a discussion. And we're going to start that off with kind of an overview from Rachel Abbey with ONC. And then once Rachel's done, I will introduce our panelists for today and share the sorts of question prompts that they've been asked to speak to. So I will kick it over to you, Rachel.
Great. Thanks, Liz. Could you hear me?
Yes, I can hear you.
Okay, great. Sorry, everyone. I can't be on camera at the moment. I'm trying to troubleshoot. My computer is updating, of course. That always happens at the inappropriate time, but alas, moving forward. So I know that you all have a lot of questions as it relates to how to participate in TEFCA. And I wanted to just kind of talk through a couple of slides so that you all are understand that there are primarily, a couple of ways that you can participate in TEFCA. One is as a participant of a qualified health information network. And those are those networks that the RCE, the recognized coordinating entity, has identified, and they've gone through a rigorous process in regards to becoming a QHIN. And these networks not only connect people to TEFCA, but they also offer additional services. And so it might, outside of just connecting you all to TEFCA. So, and then the other way that you can participate in TEFCA is being a sub-participant of a participant. So that may be, perhaps you all have, worked with a health information exchange in your jurisdiction, or a health system, or someone that has a very robust type of network, and they are planning to participate directly with a qualified health information network, with a QHIN. And so that might be another way that you could participate directly with that. You will have to sign what are called terms of participation, and those are available today through the Common Agreement version 2. And so those are outlined, and will probably, depending upon the network that you connect into TEFCA, or the TEFCA connector that you connect with, they'll probably have those terms of participation in those agreements that they work out with you all. That has to be signed at some point along the way. And so I encourage you all to take a look at those terms of participation. I mean, they're very legal. So, but I think it allows the opportunity for you to talk with your legal teams in your agency or organization, and kind of get an idea as to if this would be possible, and if not, what might be some of those barriers. So, Liz, if you could jump to the next slide real quick. And so this is just an example of how public health agencies can fit into the whole framework of TEFCA. So as I said, they could be an actual participation with a qualified health information network, and you can kind of see where the public health agency falls here. And then they could also be a sub-participant of the health information exchange, for example. But it could be any other sort of TEFCA connector. Doesn't necessarily need to be a health information exchange. Just in this example, it is. And so I think, as a first step, as you guys think about your participation in TEFCA, I think it's really important. And I think some of the jurisdictions that we have on today will probably address this. But really think about what are your options as an agency in participating with TEFCA? And does it make sense to be a participant or sub-participant? And there may be some exploration about being a sub-participant. I'm not sure. But I think how you all participate in TEFCA is really important, and exploring those organizations and seeing what services they can provide you, whether it's some sort of portal access to TEFCA, whether it is maybe in addition to just TEFCA access, they have other services such as master patient indexes that they could help in regards with your patient matching. They may also offer other services such as data analytics that may assist you as well. So I think it's really important. And then I think once you determine what types of services you and your agency need, I think it's building that piece into your plan, and then looking at the various options and seeing what, cost allocation, other things, resources, things like that would also play as a factor as well. So I think as we go through the discussion and really talk and listen in to, the presentations that the jurisdictions are going to provide, I think we'll learn. And I really encourage you all to ask questions of each other, because this is where you're going to learn from your peers as to, some sort of tactics, some sort of interesting ways to think about things so that you can then take it back to your agency and begin the process in some way or possible. So with that, first off, I did want to ask my my comrade here, Abby Vile, if she had anything else to add at this point before I hand it over to Liz to launch into the jurisdictional presentations. Abby, do you have anything that you would like to make sure to emphasize at this point?
No, I do not have anything, but I do see a hand. I don't know if we're taking questions now or towards the end, but Steve often has good questions, so I would love to hear them.
I think we can go ahead and take that from Steve, and then also just Rachel, for your awareness, there's a little chat going on around if a signature on the terms of participation is necessary for electronic case reporting, but Chris and others have chimed in and shared some resources there. So I think that's covered.
That's great.
And
Great.
yeah, go ahead, Steve.
Thanks for that. Thanks for that. And I was thinking the same thing. This question is really asked for Rachel or one of the ONC folk. Just to clarify, what are the flow down provisions and who actually needs to sign the TEFCA agreement with kind of a wet signature in what circumstance, you know, whether, especially thinking about ECR and general participation about providers reporting data through their HIEs to a QHIN over to APHL down the line. It was my kind of impression that everybody participating in TEFCA needed to agree to the terms. There was some kind of mechanism for recording that they agreed that was understandable and available to every other entity participating in TEFCA. Can you give us a little detail on that or clarify that a little bit?
Sure, Steve. So are you asking if like health departments do need to sign onto the terms of participation? I guess I'm not sure I understand what your question is.
Yes. And does it, and do all providers need to sign as well for reporting data through to the Ames platform once it actually moves into the TEFCA framework rather than its kind of pre-TEFCA environment?
Right. So anyone who's sharing any type of data across the TEFCA network has to sign the terms of participation. Again, it comes in different forms, whether, you know, you're already participating with an entity that's already connected into TEFCA. So it may just be like updating their term, you know, of their agreement with them and including those terms of participation. So at some point, yeah, they do. ECR is just slightly different because of the workflow. And so APHL and Ames are actually the entity that is the sub-participant under the model that they are looking at. So because of that, there is no need for the signature of signing on to the terms of participation, but only for that specific use case at this time. Any other use case, you have to sign terms of participation. And I'm sorry, I can't see the chat, but there is a link we can share, and Chris may have done it already on the Ames website that explains that reasoning behind that.
Yeah, he did share that. I know the current things are still or to my understanding, things were still in a little bit of flux and things are still changing a little bit. So I wasn't sure if it was still current or a little bit out of date, because I think really getting better understanding about who needs to sign under what circumstances and how our signature is validated from a hey, you're engaged perspective really becomes an important thing, especially from a legal perspective, making sure everybody is doing what they're supposed to be doing and we're not getting ourselves in trouble down the line.
Yeah, no, valid point. And I think we are going to have a meeting specifically talking about some of the legal considerations. So I think we can dive more into that during that meeting.
Right.
If that makes sense. Okay.
And Liz, before we move on, I also wanted to just take a moment, since we have a second here, to introduce Kyle Cobb, who is joining from CDC and really is going to be sort of co-leading, or really the primary CDC co-lead on this. Kyle is really leading our TEFCA strategy and everything TEFCA related at CDC. So I wanted to give her the space to even just say hi, but B, also weigh in here. Because she is way more eloquent on this and is going to be way more knowledgeable for all of you than I am.
Well, thank you for that introduction, Abby. And I think it continues to be teamwork. So we're both going to be here. You're not off scot-free, but hello, everybody. Kyle Cobb, I think I've had the pleasure of meeting many of you, but by way of just a brief and quick introduction, I have been at CDC for the last 4 months, and I came over to the Office of Public Health Data Surveillance and Technology from ONC. So it was a lateral move, and this is a world that I'm very familiar with. Steve, to your question, it is something that we're actually really paying a lot of attention to in our work streams. And I think, we would love to in future, COP meetings later this summer, actually share some of that. But with the first 2 use cases that are actually launching at the end of this month, and Chris, who's, I think here as well today, can probably speak more. I know you shared the HPL guidance for that connection, but we are paying attention to that and would love to really, because this is an access issue at the end of the day for public health. So I'd love to, tee that up for future sessions, and, also thinking about, what these early demonstrators are learning as well. We spoke to Fairfax today, and we certainly, it's Washington Department of Health and Alaska and Southern Nevada. So here we are. It's really, it's so exciting to see all of this excitement and dedication.
Thank you, Kyle. Thank you for making that intro, Abby. We're happy to have you, thankful to have you, Kyle. And I think we can definitely delve in further and keep that on our radar for an upcoming meeting. I do want to go ahead and jump into our panel because we have 4 wonderful agencies who are going to share, and you can see those on your screen. I listed both representatives that we have from each agency, although some may kind of tag team, some may just have one designated speaker. So you can see we have Alaska Department of Health, Fairfax County Health Department, Southern Nevada Health District, and Washington Department of Health, who were all gracious to prepare for this today. And so I'll just share briefly, these are sort of the discussion prompts that we provided. They'll speak to some of these or all of these. And so, we just asked the agencies to kind of speak to, when you're thinking about getting started with TEFCA, just from a high level, for what purposes, what is your agency doing around TEFCA? And we didn't want to get too far down into the use cases because we do want to get into those specifically in a future meeting as well. But then, kind of the why, like why did your agency decide to start to explore, and what was the value that your agency saw to get started as sort of an early adopter? And then we've asked to briefly describe the first steps that the agencies have taken. So, did they pull together an internal task force, or who was involved in the initial discussions? How are they approaching legal? Have they reviewed the terms of participation? Those sorts of things. And then, have you thought about how your agency is planning to participate, such as a participant, sub-participant? What is the role of the HIE? And then, just what have the biggest challenges or barriers been? And what have you done to overcome those? And then, if anyone has advice that they would like to share with another agency, we'd love to hear that. So we know that's a lot. We kind of gave them all of that to pick and choose from. And we're going to start off with Alaska. So we have Eliza and Victoria here, and ladies just let me know when you want me to advance your slides.
Good morning, everyone. Hi, Victoria Baca with Alaska, and I'm here today with my colleague, Eliza Ramsey, and we currently are kind of tagged as the 2-point people for Alaska to work on TEFCA. So go ahead, Liz. So just to kind of give you a little bit of a ground state about how Alaska arrived in this early explorer phase, we are, our HIE that we are partnered with here in Alaska, Healthy Connect Alaska, our underlying technology provider for us is CRISP Shared Services. And so that is part of what brought us to the table for exploring TEFCA really early on, because CRISP has onboarded very early as a QHIN. So we have that existing HIE relationship. So as a part of that, it was brought forward to us that there was a possibility to participate in this conversation. For us right now, you can see the couple of early use cases that we're exploring are how we are going to make use of the ECR use case. We are planning on being live on that by July 1. We're a little bit different in that space in that our ECRs are currently not routing through the HIE today. We are still early era with our use of HIE in Alaska. We are in the midst of expanding it. So our ECRs are going straight to the Ames platform right now. So it's not going to be much of a technical lift for us to shift. And then the part that we are really super intrigued about is the query capabilities. They're going to come down the road for the chronic infectious diseases, because that is of particular interest in Alaska. You move ahead.
And then I think the why, in addition to having that existing partnership with our local HIE and kind of the CRISP national network, is that we have some really critical information gaps and also some both kind of technical and workforce constraints that have us interested in kind of any opportunity to more efficiently manage information, and then also kind of manage staff time and effort, especially around high burden health issues and drivers of high cost of healthcare in Alaska. We also do feel it's important to have a state at the table and thinking about how this gets implemented and how it becomes a solution for all of us that has kind of some funkier dimensions, small population, huge state, and some kind of unique models of care. 80% of our landmass is off the road system. And so folks are getting care in communities, coming into Anchorage, going down to the lower 48. We have a lot of folks who are snowbirds, spend significant time elsewhere. And then we also welcome millions of folks each summer up to Alaska as tourists. It's almost like 3.5 times our standing population. And so there really is a need for participation in national standards and transmission of information, because care is not just rooted in Alaska, but all over. Next slide. Kind of has already come up, core to our initial activities is really thinking about that legal evaluation of what needs to be signed and how we're aligning it with existing legal arrangements. Kind of what is the relationship between our core HIE contract, the BAA that underpins that, and then what's the relationship between TEFCA common agreement and flow down terms. One of the other things that we've had some preliminary conversations with, and in addition to our kind of public health use case and engagement with TEFCA, is how do some of the other authorities and activities of our department, we have Medicaid within the Department of Health, as well as some kind of direct care provision and some kind of benefits and eligibility determination that have some TEFCA facilitated implications and opportunities, and how to think about aligning kind of all those different authorities. We're really looking forward to announcement and partnership with those implementation centers. We've really appreciated kind of participation in this peer learning group, as well as some of the conversations that have been facilitated by CSTE. And then one of the other things that we've had to kind of slow down and do a lot more is internal communication. As TEFCA's profile has been raised, we've had a lot of Alaska DOH staff kind of really ask, what is this going to mean for us? And we have to be transparent about those limits of what we do and don't know about how this is going to impact workflows. I think last slide.
Yeah, and so then we just kind of wanted to share with you a little bit of some of the questions that we are thinking about and talking about internally. And so what is that last bit of the implementation going to actually look like for us? And what are we going to get out of it at the end of the day? What is the value that we are reaping out of participating in TEFCA? And then the kind of longer term question that we're really thinking about is what is it going to look like down the road when it comes time to respond to the queries, not just ask the questions, but then also have to be the one to give the answer.
Thank you so much for that, Eliza and Victoria. I think it's great to see you kind of throw those questions back this way and have everyone thinking about that. I am going to go ahead and pass it over to Fairfax County. I think we have been planning to just talk through. I'm going to go back, hope I make no one dizzy by doing this. I'm going to go back a few slides to those question prompts just to allow Ben to talk through those.
Great. So hello, everybody. So first question is high level, what's your agency doing around TEFCA? So I think to start off, kind of where we are at is important to kind of outline. We do not have access to our state HIE, and the only access to is the one of our hospital systems electronic medical record. And so everything else that we're doing is the old-fashioned phone call, write fax way. So there's a lot of benefit for us moving forward with TEFCA. As far as kind of helping scope this out and what we're doing, it was helpful at the federal level to really kind of choose those first use cases. And so we're not moving forward with reporting. We're going to let our state office continue to work on that. But we are going to be moving forward with the query response for case investigation, and that's what we're working with. So we are early adopter and we're all systems go for meeting that July 1st deadline. And a lot of our work is again with that legal document, like all the other folks that are working on this. And the way that we're going to kind of take this on and meet that July 1st deadline is that we're going to set up a portal access for our case investigators to log into and be able to access the HIE and would allow us to then connect to that larger TEFCA network. And then in the future, we will start evaluating kind of a FHIR connection and what that kind of looks like. But after we get connected, I think, answering some of those questions that the Alaska is really kind of grappling with also is like, how useful is the data in the HIE? What does it kind of look like? And really, what are those, long-term costs kind of look like for us at a local level? But this initial pilot allows us to do that evaluation that ourselves instead of allowing kind of other folks to do that. Why did your agency start to explore TEFCA? So, it didn't really start with TEFCA. It really more started with our own agency strategic plan, recognizing the importance of informatics, and then Noel and his team really putting together a great IT roadmap, which did have us connecting to our HIE, but many years down the road. And so what it really kind of did for us is move up that timeline for us. And again, just like Alaska's, being at the table is really important, so we can really kind of push the use cases that are important at the local level. So describe the steps your agency has taken to get started. So last summer or so, Noel and I were both kind of stalking TEFCA, but we didn't really know how to get involved at all. And so finally it was on a CSTE surveillance and informatics subcommittee call that, they kind of put a call out to anybody want to be, more information about this. And that's where we kind of raised our hands. And what we did is we really kind of dove into it locally and did some rapid investigation. Not only, had that dual team mentality of having our IT team really look at like the technical feasibility, kind of the legal documents, but also Epi on my side is looking at those use cases. We started some conversations with our HIE, and that really kind of helped flush out a lot more of the details. And importantly, we got that leadership thumbs up. We had a nice short non-technical presentation to them risks, benefits, mitigations, things like that, and had a good conversation, and they were all about it. And that's at that point we started really getting talking with our county attorney to give them a heads up that we're going to need to do this legal review. Have we reviewed the terms of participation? Yes, and we do have that with our county attorney. They've actually liked some of the legalese in there, and they've definitely thought that there's been some good thought in how that's phrased. It's well done. No red flags with version 2 so far, but they're going to get their kind of final review to us by the middle of next month. Have we thought about how we're going to participate? We are going to be a sub-participant. Our state HIE and Chris will kind of be that participants, and then they connect to the QHIN eHealth exchange. What have been the biggest challenges? It's really the timeline of this first pilots. And so it's really just put a lot of kind of pressure to get everything together. And what we've done to kind of adjust that is adjust the scope. We're going to do a portal access, get through the legal documentation, get access, and then really do some in-depth analysis of what's there kind of later on. And then finally, one piece of advice, it's really ensuring you kind of develop that IT roadmap for the agency. And it's not only about what you're going to take on or what resources you need, but also, who's going to really help you get there and those relationships. And so for us, it was, making sure we have a strong relationship with our state office, our local Department of Information Technology, our attorneys, and also our health department leadership. And thank you for the opportunity to talk today.
Thank you so much. It's really helpful to hear just those detailed steps and all the things that you've thought through to share with others. So there are some questions and some responses coming through the chat. We have our eyes on those. I'm going to hold those until our next two panelists go, and then we'll do that all at the end. But I will go ahead and kick it over to Southern Nevada Health District.
Good morning, everyone. Can you hear me okay?
We can hear you, Lei. Thank you.
Okay. I did prepare one slide, but I think this one is good. I can start with the purpose. Is our main purpose for participating TEFCA is trying to implement a QHIN query portal through our state HIE, and then which will enhance our disease surveillance and complete the investigation timely, and also reduce our staff workload. As mentioned, Alaska and the Virginia as same purpose is, as you know, is Las Vegas. We host millions of visitors every year, and if they have some cases of the monkeypox, measles is from out of state, our disease surveillance team really like to get their medical record, and vaccination history record is timely, so we can complete the investigation timely. Another use case is we are thinking about the HIV patient, because we have some patient with HIV condition moved into Las Vegas, moved to the Clark County. We like to access their medical record from other state and jurisdictions. So we just make sure they have continuous medical care, because we have a link to care program here. And then we just want to make sure there are no discontinue of the care. So those are the trigger why we want to do those things. And then because QHIN, the TEFCA give us this potential, we just submit the queries through one portal, can get all the medical record through the from the nationwide network. So that's the thing. In addition, that one is we currently have other project with our state HIE, and then they help us to build the fire portal and the ECR reporting through the HIE. So we like to integrate those two projects together, and so we can get unified ECRs from nationwide and then consume into our disease surveillance system. That's the purpose, and then that's why we start explore TEFCA. And then the first step is first step is when we heard the TEFCA and look at the potential of the TEFCA, we give the presentation to our internal team, to our epi team, to our disease surveillance team. And then lately we give a presentation to our county board of the healthcare facilities and to see this is coming, what's the TEFCA, what's the potential. So kind of education section. Second one is we work with our disease surveillance team closely to identify the use cases, and then they all get excited. All those can apply to all the outbreak investigation. We just pick those two I just mentioned above. And then we talk to our HIE, and then because we already have a close collaboration relationship during the pandemic, and then we just say, hey, can we do the QHIN? They say, sure, because they're connect to the eHealth exchange. So one of the designated vendor of the QHINs, so we can do it. So that's the sense right now is we have internal discussion, we figure out all the details, work plan and requirement, but we also engage with the CDC. So we will have a first meeting, I think end of June, and then we will talk about all the detailed steps. So the participant plan is, of course, we will participate TEFCA as a sub-participant through our state HIE. And then that's the thing, as I mentioned, is we can leverage existing FHIR project. So our hope is the result from QHIN's portal can integrate with the HIE query portal to generate the one integrate the ECR reports into the health department, so we can consume through our AMSA into EpiTracks. So the challenges is there are two. We are at the early stage of the implementation. Technical challenges is one thing is we just learned from HIE is currently they have to submit the two separate queries in order to get all the data from Houston's network. So one is just query the state HIE data system, and another one through the eHealth exchange. And then we have to find a way to integrate them together. So another thing is because they're also doing the system upgrade. So, and they only have limited resources. So that's why we're trying to work with CDC to see if we can get some guidance and support all those issues, all those challenges. Another one illegal thing is mentioned is since we are at the early stage and we haven't touched the topic yet, but we do have our leadership support, and then hopefully that will be a smooth process. But I know is any agreement contract and will be take a long time work with our legal department. So we will address those issues after the first meeting with CDC. So the final thing that I'll give a piece of advice, and then basically is collaborate with your state HIE if you have good relationship with them. So we figure out that will be much easier, smoother to implement TEFCA through the state HIE. So that's all my presentation, and thank you for this opportunity.
Oh, thank you so much for sharing. It was really helpful to hear those details, and we will, if we have time at the end, hear a little bit about some resources related to HIEs. So we'll try to save some time for that. And just to round us out, last but not least, I'm going to pull up Chris's slide here from Washington, and we can go ahead and hear from Washington State.
Thank you. Yeah, this is just kind of our conceptual diagram, and it helps us look at all the potential. What we tried to do here really is consider, especially the 7 or 8 core data sets that CDC has put forward in their common DUA, and have thought about how TEFCA could possibly help with the exchange of information for those data sets. Some of the specific use cases I'll mention that haven't been, I think, mentioned already that we're specifically interested in is I think there's a lot of utility in TEFCA for patient unified lookup system for emergencies, or PULSE, during a natural disaster, when you need to be able to quickly find medical history on people who are coming to a emergency pop-up kind of tent, and they literally just have the clothes on their back and they don't remember their medications and other things. I think there's a lot of applicability as well for looking at pieces of individual access services, things like immunizations. You know, where can we as a public health agency provide data back to the public, building a lot off of our smart health card concept during COVID for COVID vaccines. Chronic disease surveillance is another one that we're really intrigued by. Chronic diseases still is the leading cause of morbidity and mortality in the nation, and yet, you know, we tend to have a lot more focus on our infectious disease, and it'd be great to see some work in that space. And then coming back again to that common data use agreement and the new concept of DEX and the front door at CDC, we're really intrigued by, you know, could TEFCA provide a way to simplify data sharing to CDC across all those common data sets that are they have prioritized? You know, I think it'd be great to consolidate the transport from stilts to CDC. Why did our agency start to explore TEFCA? It's really, for us, I think, a way to improve interoperability with our clinical partners and other public health jurisdictions. We recognize that point-to-point connections and managing a lot of data use agreements is costly, and there's a lot of overhead and time involved with that. And, you know, a nationwide approach can really streamline and simplify to help us make sure we receive the data we need. But I think it also can help us provide data back to our clinical partners in more efficient ways when you think about things like immunization history and forecast, or for state health departments that run their prescription drug monitoring program, providing controlled substance history back. Our steps that we've kind of looked at taken so far, we've been assessing places where this can benefit us, not only as a public health exchange purpose, but also I think a lot of health agencies, including ours, you know, do have treatment exchange purposes that could be beneficial under TEFCA. So I think it's helpful to consider both and figure out where you want to start. I think we're still evaluating, you know, the costs for developing this connection, as well as, you know, what it might take to maintain it. I think that's still a lot of unknown there for us as a public health community. On-ramping options, ours has become a little more complicated. Our HIE is not in a good place right now, so we're trying to decide our on-ramping strategy, but that's an important piece. Legal review, we have completed and turned in some feedback on Common Agreement version 1. We're excited to see updates in version 2, and we're still reviewing that right now. We've also, of course, participated in the review of the Public Health Standard Operating Procedure and Educational Document. We're hopeful that the RCE will release those soon so that we can see kind of where those landed. There's a lot of that guidance outside of the Common Agreement and technical framework that I think we really need. As far as who we've involved in our agency, you know, really it's been two fronts. I've been kind of taking a lot of the management of this, and so part of it has been that kind of legal privacy risk management track, where I've been focused on working with our privacy officer, our risk manager, and our assistant attorney general. And then for the more technical pieces, it's really been looking at working with our business partners within the agency, finding the use cases, and then prioritizing some of those, and then really focusing on estimating costs and solution designs with our informatics and information technology partners within the agency. Our preference, if we can I think really would be to on-ramp as a sub-participant. I think if you can use your state HIE, it's a great option. And so that's certainly our preference when we think about onboarding. Some of our challenges, I think, is Washington has a very unique set of local laws and rules that make some of the navigation of the Common Agreement very challenging. We have a new law out called My Health, My Data that really protects a lot of information. We have a lot more strict privacy rules around certain conditions and certain types of treatment that could make it really challenging. We also have a very, very broad and open Public Records Act. And so ironically, there's some cases where we're concerned that we may receive data through TEFCA that we wouldn't want to disclose and then actually have to disclose it as part of our Public Records Act. And so there's going to be some very tricky and intricate legal reviews to help us understand, how we can all make that work. I think the cost estimates is another big challenge. The query response, for example, we're trying to look at how can we create an enterprise solution that really could be leveraged across a number of our systems. Because there's so many potential use cases for that idea of a query response. So trying to figure out how do we set ourselves up for those more enterprise solution approaches, I think for these use cases is important as well. As far as getting involved, I would really encourage folks to consider starting with that ECR use case because it is such a low barrier for adoption, especially if you already have ECR live today, and it'll allow you to kind of easily get an understanding, get your feet wet, if you will, of how TEFCA works. We've really appreciated getting to work with eHealth Exchange along with Epic and a healthcare system that's been identified in our state for our first adoption in that space. And yeah, I just think it's a great way to kind of easily dip your toe in the water and start getting familiar with some of the terms and how it works. Because again, there's no need to sign the flow down provisions for that specific use case. And if you're already receiving ECR today, it's mostly just the fact that the data upstream will be coming from a QHIN to eHealth Exchange first. Which is an exciting way to get involved. And then just participating in some of these groups, several of them mentioned already, I think, and starting as early as possible on those legal reviews, because I think, often while there can be technical challenges, as we all know, policy tends to hold things up a lot more than technology does. So I think that's an important thing. I know looking forward, some of the potential challenges we're thinking about, especially with query response, is how do you reconcile and deduplicate records that come back? So if I queried the network and asked for additional information on someone and I get back 5 different responses across that network, how are we going to reconcile and deduplicate those records that are coming back without, providing just a whole bunch of more, manual work for someone to dig through? So there's just one potential challenge I'll add to that I think as we continue to explore TEFCA will be interesting to see how do we address some of those.
Thank you so much, Chris. It's so helpful to hear these applications from all the agencies, and hopefully it's been helpful to kind of hear where you've all started your thinking and efforts in these states. I do want us to have a few moments for questions. It seems like we have a few in the chat that have primarily been answered. I'm just checking it. If Osa or anyone else has been following that, feel free to jump in. But Steve, your hand is still up. I'm assuming that's from earlier. Let me know if not. But there was a comment as follow-up to the Alaska presentation from Kate and Tennessee. Kate, do you want to speak to that at all related to how public health responds to queries and what you're thinking about in Tennessee?
Sure. I don't know that I want to talk about what we're thinking about in Tennessee because we don't have an answer, but I was just kind of outlining the difference between what we collect as public health entities and what we provide as clinical entities. And one of the questions that has come up is, what is our what we would consider re-notification duty under some of this? So if we have data on a patient that we did not run or collect ourselves, so things like lab results from a secondary provider that they themselves could or should be participant in the HAE, but we didn't generate that data ourselves, right? We didn't order the test, we didn't run the test, we didn't report the test. Kind of where's the line on what we should or could be reporting back as part of a query response? Is really the question I was bringing in.
Yeah, I think that you all have raised a lot of questions for everyone to be thinking about. Kyle has noted that CDC as well as ONC are really looking at these. So is ASTHO, who will share a bit about that in just a moment, and collecting kind of some of these frequent questions. So we will make sure these are documented and being tracked. But I do see a couple other questions that I'm going to try to get to in the chat as we get kind of close to wrapping up. And I do still want to give ASTHO and Civitas just a minute each to share their resources. So from Aparna, how have you worked around DUA? This would be more relevant to counties and cities. If anyone on the panel could speak to that or has made any progress in that area. Anyone want to take that one? Has anyone gotten that far? Seems like a lot of you are still working on those legal aspects.
Liz, this is Jessica with Civitas. Happy to jump in here. I am not a lawyer or an expert on DUAs, but I would say that that is one benefit and value add of working with an entity like a health information exchange that is a local entity that already understands the policy of the local community, likely has data use agreements in place with the entities that are looking to exchange the data. So just food for thought as you're exploring opportunities to be a participant or a sub-participant, that local infrastructure and partnerships of the health information exchanges could be valuable with things like DUAs.
And Jessica, while we have you here, I feel like I would like to just have you introduce yourself and take a moment. We could come back if we still have time to another question, a little bit out of order, but one of the example partner resources that we plan to share today was just making sure that those on the COP are familiar with Civitas. And so Jess was going to take a couple of minutes to share a few relevant resources like this one with us.
Sure, quick. I'll go quick. I know we're low on time. I'm Jess Little. I'm Vice President of Business Development and Programs with Civitas Networks for Health. If you are not familiar, we are a mission and membership organization. We have a lot of different types of members, but for purposes of today, the health information exchanges that serve local counties, regions, states, and some across multiple states are members of Civitas. And so we bring members together to talk about important topics like TEFCA. What is the role of health information exchanges and the local infrastructure as a national network like TEFCA is rolled out? You've heard that role from all of the jurisdictions that presented today. And so we have done a number of different things with ONC directly, like conducting listening sessions where we're learning about TEFCA and our members are learning about TEFCA directly from ONC, and also providing feedback about what implementation looks like on the ground. And we're also, just like this conversation is bringing together state agencies, we bring together the health information exchanges to talk about where they are with implementation, and so they can share best practices and challenges with implementation. We also have vendor type members. So the majority of the approved QHINs are Civitas members. So you've heard about eHealth Exchange, Kanza, Med Allies. They are all members. Health Gorilla is a partner of Civitas. And so as a resource to all of you, if you have questions about, your local agency or what other states and jurisdictions are doing and how are partnerships already formed between public health departments and health information exchanges, we can be a resource for that. So we're not here to, tell health information exchanges or public health departments how to do this work, but we're here to convene and help bring together the right people, including those that already have connections to their, localities in their regions. So happy to share more. That's a pretty high level overview, but if you're looking to understand what infrastructure exists in your community today, if you're not already familiar, we are a resource.
Thank you for that, Jess. And we will be planning in the post-meeting survey. There's an opportunity for anyone else who has any resources they would like to share at an upcoming meeting, or just that we can send out. We have a place to capture that. So I do want to go ahead with just a few minutes left to introduce Alex Woodward, Senior Advisor with Public Health Data Modernization with ASTHO, to give an update on a couple of the resources. I know we still have lots of questions out there. So Alex, we've been working to align together across CDC, ONC, and ASTHO to be collecting questions as they come up, and they're working on some really nice resources that she just wanted to briefly highlight today. Alex, are you still there?
Yes, I'm here. Thank you so much for the intro, and I won't reiterate my intro. So ASTHO held an ASTHO Connect session on April 4th called TEFCA Overview and Perspectives from the Field. I know many of you were part of that session. We received a ton of follow-on questions in the Q&A and chat. So we decided to create an FAQ document with all of those questions. Since then, we've also received some questions from this community of practice and from outreach from our own members. Right now, we have about 50 questions in our FAQ document that we are working to answer, and we've answered many of them. The FAQ will be published probably in the next few weeks. It is considered a living document, and we plan on updating it as questions come in and as we're able to answer the questions. We realize, TEFCA is a very rapidly evolving area of work. So questions are going to keep arising. So wanted to share this as a resource that will be coming soon and we'll make available to you all.
Thank you so much, Alex. And I know you guys are working on some other things like a roadmap, and we'll keep everyone apprised as those are developed. I really appreciate all the dialogue that's happening in the chat. That's what we really want to bring you all together. Again, we'll be sure we're capturing these ideas to touch upon in future meetings. I will go ahead and just share a couple of the next steps. Lux is going to go ahead and drop into the chat a brief post-meeting evaluation survey. We would just love to get your input on any topics that you would like to see covered in the future, any resources, again, that you're looking for or might know of that could be beneficial to others. And this is the agenda of our upcoming meetings through August for the COP. So we did tweak that June date from the last time we were all together based on a conflict that was identified with ASTHO. And we tentatively will include a discussion related to more the technical aspects and how fire fits into the TEFCA framework, and an overview of what fire can potentially offer for that June meeting. But we know there's a lot of other content in terms of implementation centers and the status of those, as well as use cases and legal considerations. So we'll be trying to interweave those into future meetings as well. And just stay tuned and we will keep you posted. You should have received calendar invites for all of those. Please let me or Lux know if you have not, and we will make sure to get that to you. So we're right at time. Thank you all so much for your participation today. We really, really hope that this is valuable for you all to be able to hear what's going on among your peers, and we look forward to seeing you in just a few weeks. Have a great rest of your Wednesday.